Hey guys, what's up? This is Alex here from HealthFlow, and today you are going to learn what BLS means in the medical environment. For subtitles in your language, check the CC box down below and stay tuned. So what does BLS stand for? BLS stands for Basic Life Support, and it's practically a concept of how to resuscitate a patient. BLS covers CPR, so mouth-to-mouth ventilation, and also chest compressions, as well as early defibrillation with an AED. In the next few minutes, you're going to learn how to save someone's life. And in the next few minutes, we're also going to take a quick look at how to really do a good resuscitation. The information you're about to receive in this video are based on the latest 2010 AHA guidelines, and this video is intended for lay rescuers and covers adult resuscitation. Alright, so let's start by taking a look at this BLS algorithm. And usually algorithms can be very complex and very confusing sometimes even, but this algorithm you see right here has actually been simplified so that it's easy and very simple to understand. So let's make a case. Let's say you just walk down the street and all of a sudden you see a person laying on the street right there or on the sidewalk. So what should you do? So as the algorithm suggests, you should first go to this patient and see if this patient is responsive. So you would go to this patient and would shake him a little bit on his shoulders and would say something like, "Hello, can you hear me?" or "Are you okay?" It might be that he's just sleeping. If you can't wake him up or if he doesn't respond in any way, see if he's actually breathing or gasping for air. So whether the patient was breathing or not, you will now have to call an ambulance. Since you couldn't wake him up in the first place, he definitely needs professional help. So if you're in the States, you would call 911, or if you're remote throughout Europe or Germany, you would call 112. So now let's say that the person you've encountered on the ground did not breathe at all. So now depending on the situation, you would first apply CPR or you would first defibrillate with an AED. But let's say in this case there is no AED around, so you would first start to apply CPR. Therefore, we're going to take a quick look first on CPR, and later on we're going to take a look on AEDs. So what does CPR actually stand for? CPR stands for cardiopulmonary resuscitation, and it includes mouth-to-mouth ventilation as well as chest compressions. Now in this case, after you've answered all the dispatcher's questions, you would now start applying 30 chest compressions. The 2010 AHA guidelines emphasize the importance of quality chest compressions since they are so vital for a positive patient outcome. So there are two ways of how to put your hands or how to use your hands when you do chest compressions that I know of. The first one is like this, that you putting one hand above the other and then you close the fingers of the hand above. The second is like this, just putting one hand above the other. For me personally, I found the first way to work better since it gives me a little bit more stabilization of both of my hands. To find the proper hand placement, look for the lower end of the breastbone, the sternum also called. Then you put two fingers on this spot and then take your hand and place it above the two fingers so that the fingers of the second hand face toward the left chest and cover the left nipple. When applying chest compressions, to apply force the most efficient way, your upper body should be centered above the point where your hands are placed. And you also want your arms to be completely stretched out at an angle of almost 180 degrees. Otherwise, you will not be able to really apply force and you will tire very fast. So quality chest compressions really do depend on the proper hand placement, but they also depend on the compression ratio, on the compression depth, allowing completely recoil after each compression, and as well to minimize interruptions, the so-called no flow time. In contrast to the 2005 AHA guidelines, which stated that the compression ratio should be 100 per minute, Now the 2010 AHA guidelines state that the compression ratio should be at least 100. The compression depth should be around 5 inches, which is about 2 centimeters, and especially when you resuscitate elderly people, it might actually be that when you do really good resuscitation, actually a rib might break and you might hear it, and that might sound not really cool, but life really does come before a broken rib. When you resuscitate a patient, make also sure to completely recoil after each compression, because if you don't allow the heart or after each compression to completely recoil, the heart is kind of left in a still a little bit compressed state, and so not 100% of all the blood that could go into the heart for the next compression to flow out actually has the chance to fill the heart this way. And finally, the last component that makes up good chest compressions is to minimize the no float time. And so after you would apply 30 chest compressions, try to only use 2 seconds for 2 rescue breaths. So 1 second for each rescue breath, and this way to really reduce the no float time. So remember these 5 factors that make up quality chest compressions. First, we had the proper hand placement, we had the rate, the depth, complete recoil, allowing for complete recoil, and fifth, we had to minimize the no flow time. So after applying 30 chest compressions, you should apply 2 rescue breaths. When you apply rescue breaths, you should kind of tilt the head with the head tilt chin lift method if there's no indication for a possible cervical spine injury. If there is any indication for a possible cervical spine injury, then you use the jaw thrust method. A CPR mask may be helpful to avoid contact with the patient's mouth. Quickly apply 2 rescue breaths and then continue with 30 chest compressions. You would continue applying CPR for as long as help arrives or until you fatigue. Now, after having learned all this cool stuff, let's watch a short video on how James Bond is actually doing. And I want you to pay attention what he does right or what he does wrong. Alright, so how did he do? Not too good, right? So what did he do wrong? So he didn't really apply 30 chest compressions, as you could see in this clip. He kind of just did, I don't know what it was, like 5, 6 really bad chest compressions. Why were they bad? They were bad because he didn't really apply much force. I mean, did you see he was like, he didn't have his body centered above the patient's body. He didn't have his arms really stretched out. And worst of all, he just gave up after such a short time. So remember that resuscitating is really physical work. It's really working on someone else's body. Now, one more last very important component of BLS that we have to talk about are AEDs. And AEDs are truly life saviors. So AED stands for automated external defibrillation, and they are practically defibrillators that are really easy and really simple to use. So fortunately, you can already find many AEDs on airports, train stations, public places, and many companies they're placed there already. So that is really, really good. And so when you look for an AED, look for a sign that looks like this. This way you can really very quickly see if there's an AED around. So in the case that you know there's an AED around, or you're not the only helper and someone can go and look for an AED while the other one is applying CPR, it makes sense to look for an AED and to defibrillate as early as possible. So AEDs are very simple and very easy to use. once you found an AED, you take out the electrodes that come with the AED, and on the electrodes you will see a picture that actually shows where you should place each of the 2 electrodes on the patient's body. So you would kind of take off the clothes of the patient's body, place the electrodes on, and then turn on the AED. Once you've turned on the AED, it will lead you through the process of defibrillation. So it will tell you when you should apply CPR, when you should stop. It will tell you if a shock is actually advised or not. And if a shock is advised, it will tell you when you should stand clear of the patient. So this way, AEDs are very simple and easy to use, and really anyone can use them. If an AED is around, it should be the first priority or the main goal to defibrillate as early as possible. Defibrillation is really the only thing that can really reset the heart to a normal rhythm. Now let's take a quick look on a real life video in which police officers resuscitate a male patient.
Please, he's dying. Please, dear God. My daughter's on the phone, so I help my husband. Calm down and listen to her. Don't hang up. Please hurry. Oh, dear God.
Back up.
Oh, let's get him up here. Ready? Oh, my God. Lily, come here. Please, is there anything in the mouth? No! 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Please save him! Yes! Please save him! Please, dear God! That police helicopter, they're doing that. Dear God, Jeff, stay with me, baby! Holly, stay with me! Jeff, please stay with me, oh dear God! Dear God! Oh, I don't know, they're not together, pumping his chest right now. Please, Jeff! Oh, dear God!
You got it on? Yeah. Okay.
I don't know what's wrong. Jeff, honey, baby! You can't, you've got to stay with me. Stay with me, baby. Baby, stay with me. Yes, Lucas!
Okay.
Don't touch him, okay?
Clear of patient. Analyzing heart
Okay,
rhythm.
thank you.
Shock advised. Stay clear of patient.
Don't touch, stay back.
Go ahead. 1 minute, 30 seconds until analysis will resume.
We still got 1:30. We're gonna have to pull him up the hill a little bit more. Okay. Right. You did a good job. You did good. Please, no. Honey, baby, you breathing? Jeff! Honey, help him! Yes, ma'am. Please help him! Calm down. Help him, oh dear God, please. Oh, Jeff, honey, stay with me, baby! Please stay with me.
So really great job to these guys. I mean, you could see in the video that they started CPR very early on. They pulled the guy out of the car. Later, another policeman came rushing into the scene and bring in AED, and they were able to shock the patient even before medical services arrived. So really great, tremendous job what these guys did. But you can also see in this video how much physical work it was actually to resuscitate this patient. And as well, it's such a stress, it can be a very stressful situation, especially when family members or friends are around, such as in this video. So don't forget, people do depend on your help. And if you take anything away with you from this video, it is that you should just help. So if you found this video interested and you're interested in BLS and emergency medicine, here's my appeal to you. Look online for some CPR course where you personally can practice on a puppet and can practice CPR. There are many organizations out there that offer these practical courses, and it might be really, really important someday to someone else who depends on your help. BLS, be prepared for the unexpected. If you liked that video, Don't forget to subscribe as always and to hit the like button, and see you next time.